Doctors often face systemic obstacles that prevent them from implementing the most effective treatments for their patients. Insurance limitations are a major barrier, as many innovative or specialized therapies aren't covered, leaving patients unable to afford them. Physicians may hesitate to suggest these options, knowing the financial burden would fall on the patient. Additionally, gaps in medical training can leave practitioners unprepared to adopt newer, evidence-based methods. Medical schools and residency programs may not always prioritize emerging treatments, causing doctors to rely on outdated protocols simply because they lack the confidence or knowledge to try alternatives. Another challenge is the slow adoption of new research into clinical practice. Even when studies support a treatment's effectiveness, bureaucratic hurdles and institutional resistance can delay its integration. These barriers create a frustrating cycle where doctors are aware of better options but feel powerless to use them. As a result, patient care suffers, and the healthcare system perpetuates inefficiencies. Addressing these issues requires systemic change. From revising insurance policies to improving medical education and streamlining the implementation of new research. Without these reforms, the gap between knowledge and practice will continue to widen. Doctors frequently face the challenge of patients who are hesitant to embrace new or innovative treatments, often due to deep-rooted skepticism or a preference for traditional methods. This reluctance can stem from cultural beliefs, past negative experiences with healthcare, or a general mistrust of medical advancements. For instance, a patient might refuse a newly approved medication because they believe older, more familiar drugs are safer, even if evidence suggests the newer option is more effective. This creates a barrier for physicians who want to provide the best possible care, but feel constrained by patient resistance. Effective communication becomes crucial in these situations, as doctors must balance respecting patient autonomy while educating them on the benefits of evidence-based alternatives. Cultural beliefs and social influences also play a significant role in treatment preferences. In some communities, alternative therapies or home remedies are highly valued, making patients wary of conventional medical advice. A doctor proposing a new treatment might encounter hesitation simply because it deviates from what the patient's family or community trusts. Additionally, language barriers or health literacy gaps can amplify misunderstandings, further complicating adherence. To overcome these obstacles, physicians must employ empathy and active listening, tailoring their explanations to align with the patient's values and concerns. Building trust through transparent discussions can encourage patients to consider innovative treatments while honoring their cultural perspectives. Another major hurdle is patient adherence, where even those who initially agree to try new treatments may struggle to follow through. Factors like complex dosing schedules, fear of side effects, or financial constraints can lead to discontinuation. For example, a patient prescribed a cutting-edge biologic therapy might stop taking it due to high costs or perceived inefficacy after a short trial. Doctors must address these practical challenges by collaborating with patients to find feasible solutions, such as connecting them with financial assistance programs or simplifying treatment plans. Engaging patients as partners in their care fosters a sense of ownership, increasing the likelihood of long-term adherence and better health outcomes. Closing the gaps in modern healthcare demands a multifaceted approach, beginning with continuous education for medical professionals. Many doctors lack exposure to cutting-edge treatments due to outdated training curriculums or limited access to ongoing learning opportunities. Professional development programs, such as workshops, online courses, and interdisciplinary conferences, can bridge these gaps by equipping practitioners with the latest evidence-based practices. By fostering a culture of lifelong learning, healthcare providers can stay ahead of evolving medical advancements and confidently integrate them into patient care. Policy reform is equally critical in dismantling systemic barriers that hinder effective treatment. Insurance limitations, rigid protocols, and bureaucratic red tape often prevent doctors from adopting innovative solutions, even when they are proven effective. Advocacy efforts must push for insurance coverage expansions, streamlined approval processes for new therapies, and incentives for healthcare systems to embrace modern practices. Collaborating with policymakers to align regulations with current medical research can create an environment where physicians have the freedom to prioritize patient outcomes over administrative constraints. Finally, patient engagement is key to overcoming skepticism and fostering trust. Public awareness campaigns can educate communities about the benefits of evidence-based treatments while addressing cultural or generational biases. Transparent communication between doctors and patients. Through clear explanations, shared decision-making and accessible resources can improve treatment adherence. Empowering patients with knowledge helps them make informed choices, while doctors gain confidence in recommending newer, effective options, ultimately leading to better health outcomes.